you might have individuals that have chronic problems or they need treatment over a period of time. If they're to be readmitted to the hospital, would they see the same hospitalist?
Not necessarily. Basically, that would depend on which one of us happens to be on call that day. We do communicate very well, obviously, among each other. If there's a patient that Dr. Yerkes just had in the hospital, I would talk to him about what went on, his thoughts, what he anticipated may be issues. And so that way, even if it's not the same physician that's seeing them, we do have that continuity of care.
And while we're talking about that, while the patient is in the hospital, maybe for a 2 to 3 day stay, maybe 5 days, just depends on, I guess, what's going on with the patient. Do they see the same hospitalist, or do you all rotate between each other?
Typically, they will see the same physician. That's one advantage to the way we do our schedule is we do blocks. So in other words, if a patient comes in on a Tuesday and they're discharged on a Saturday, the same doctor would typically see them during the entire stay. The exception to that would be if they come in on the last day of someone's shift before they have time off, in which case it will be handed off to the next physician. But again, that's communicated in what we call a handoff or a checkout, so the oncoming physician knows what's going on with the patient.
Good points. What about billing during the hospital stay? How does that affect the patient's bill with the hospitalist?
Well, we maximize the care we give, and one advantage to a hospitalist is we are efficient. We don't order unnecessary tests. So in that respect, we try to provide the maximum amount of care with the least amount of procedures and so forth. In terms of billing, patients do get a separate bill from the hospital and from us, which will be billed as Hardin Professional Services. Similarly to if their primary care doctor admitted them, they would get a bill from the hospital and then from their primary care provider.
So they may see some different bills, but that would be for the services that were rendered in the hospital from the hospitalist and then also from the hospital?
Yes.
Okay. We've been talking about individuals that might be hospitalized at Hardin Memorial Hospital, and we now have the role of the hospitalist. If a patient is in the hospital, a lot of times they have multiple physicians if they have different things going on. Maybe they have a cardiologist, maybe they have a pulmonologist. While they're in the hospital, do they see those types of individuals too, or does the hospitalist take over that role?
Well, certainly in some cases they would, and it's variable depending on why the patient's in the hospital. One advantage to being a hospitalist and being that this is what we do every day is we're very comfortable taking care of a variety of problems. So we don't always need to get a specialist involved, but certainly we know when we need a specialist, and particularly if someone has a relationship with a specialist, be it a cardiologist, a pulmonologist, a nephrologist, we do communicate with them. And if we need them on board, then certainly they would see the patient in the hospital as well.
Right, and the communication is always there back and forth to make sure that that care is given. Same thing again, we've been talking about care, but medications too. We always make sure that we know what medications that they're on and allergies and side effects, et cetera, too, as we're educating those individuals, taking care of them in the hospital. Dr. Desai, tell us a little bit about, we've been talking about the role of the hospitalist. Let's go back to maybe historically how that came about.
Hospital medicine in general started about in the mid-90s to late 90s. Prior to that, going backwards, there were no hospitalists. A lot of pressures on the system created this niche, this need to have a hospital medicine movement start. As more patient advocate organizations, third-party payers started putting pressures on the hospital systems to deliver care effectively, efficiently, and also to reduce certain morbidities that can happen while a patient is hospitalized, certain safety goals, they realized that they needed to partner with certain types of doctors who can help them reach those goals. A family doctor, for instance, may have a full day of a schedule in their office, and a test may come back that may need to be addressed, an emergency may arise that may need to be attended to, and with a busy schedule, even a specialist for that matter, may be busy in a hospital, and they're not able to address those things as effectively. And that's what led to the moment of starting doctors that specialize in taking care of hospitalized patients who are available to address all those needs. And thereon, the growth of hospital medicine has been astronomical. In the early 90s, there were no hospitalists. And now it's the fastest, over the past decade, it has been the fastest growing specialty in America. And it's still growing, and it's probably going to continue for the next decade.
I was going to say, I think that's a good point, because this is a national trend, and it's something that
it's not a local
happening.
Thing.
Exactly, it is happening everywhere, and that's because of the need, and because we want to provide quality care to the patients.
Right.
So it's not just, again, in our area. It is something that is here and going to stay.
Right.
I think.
And the goal for the patient, again, is to get their care, get their problem addressed, and make sure that they leave the hospital without any morbidities happening, falls, infections, blood clots, all those things. So you need somebody there who specializes in a hospitalized patient's care, and to get those goals accomplished. And I think that's why this whole moment started, and that's what we're here for.
Well, I think this has been great information for our viewers to find out a little bit more about the role of the hospitalist. We hope you've enjoyed this episode, and if you'd like more information, that you'd go to our website at www.hmh.net, or maybe even look up some information about the Society of Hospital Medicine. Thank you again for joining us, and we hope you tune in next month for another important edition of Health in the Heartland.